In here, the ringing never stops.
Suicide Prevention Center, crisis line. My name's Rebecca. What's your name?
24 hours a day, crisis counselors at California's D.D. Hirsch Suicide Prevention Center field an endless barrage of calls from people at their lowest moments. The nation's oldest and largest suicide hotline averages about 130,000 calls every year. The company provided video to give us a look inside the operation.
Our job is really to provide emotional support to those that are either in suicidal crisis or emotional crisis, whether that's caused by a disaster or not.
Carolyn Levitin oversees the hundreds of volunteers and workers answering the phones every day.
They're there to be empathetic, to validate what someone's experiencing, and to also provide resources and other options other than suicide.
Now, with cases of the coronavirus rippling across the country, millions isolating at home, and hundreds dying every day, the hotline's call volume is exploding with fears about the disease. By the end of February, just 20 callers expressed worry about the virus. By the end of March, that number skyrocketed to over 1,800, with 1 in 5 expressing a desire for suicide.
It's very concerning and traumatic for people. We're seeing an overall increase in calls. We're seeing an exponential increase in our COVID-related calls.
And so do you still struggle with those thoughts?
Top concerns range from extreme anxiety and stress to fears about health issues, relationships, loneliness, isolation, and increasingly, job loss and financial stability.
They're simultaneously dealing with other stressors, such as being isolated, being disconnected from social supports, losing one's job, being furloughed, not knowing if your utilities are going to be shut off if you can't pay the bill.
What are the biggest challenges that are facing the crisis hotline right now?
So we've never seen a time where all of our counselors are experiencing the callers and chatters are. So sometimes calls can be triggering if a caller has a situation that's very similar to your own. We've also had to worry about health and safety in the space itself.
That safety was called into question when 2 workers in the organization tested positive, forcing 40 people into isolation. The company is now locked in a rigorous schedule of deep cleaning and temperature checks as they scramble for a solution to have staff work from home without violating health regulations like HIPAA. I spoke to bilingual crisis counselor April Rosas from her home at the end of a week-long quarantine.
We have to put our feelings aside during this because they look for us to be that voice of comfort.
April works 2 overnight shifts back-to-back, handling calls from when she checks in after midnight to 8 o'clock in the morning.
Mental health workers, law enforcement, we're all needed. And so we can't have that fear. But of course, it's a fear for everyone. Every day that you go out, that can be our only focus. We still have to attend to a lot of people that are in need. Every time, I'm getting off a call, they're like, thank you so much for being there. I don't know who else I would have reached out to right now. I have no one. It's 3 in the morning. And that honestly is what keeps me going. And I think a lot of us, knowing that we can be that other on the other side of the phone and be there for that person who needed us, I think that's kind of what the whole purpose of this is.
If you or someone you care about is thinking about self-harm, there is help out there. You could speak to a counselor right now. Call the Suicide Prevention Lifeline. That number is 1-800-273-8255.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.